Hello, everyone, and namaste. Hope you're all doing well and staying safe. This is Dr. Srinidhi Chidambaram, and I'm really happy to see all of you today on the COVID Care series presented by Apollo Hospitals. India's second wave of the COVID 19 pandemic has been quite severe, but we are now witnessing a downswing in the second wave in many states, and hopefully it will be sustained even when the restrictions are being cautiously lifted, and certainly with a lot of lockdowns happening in different parts of the country, with vaccinations picking up and people hopefully following the precautions very carefully, we should be able to see a sustained downswing in the second wave. But what about the third wave? One of the models of prediction called the Sutra model says that the third wave of the COVID pandemic is expected in 6 months' time, but its impact could be less severe. But what defines a wave in any pandemic at a national or a regional level? How likely is the third wave and will it be severe? The term wave is used usually to describe the rising and declining trends of infections over a period of time. The growth curve resembles a wave, hence it is called that. COVID-19 has continued relentlessly all over the world for the last 1.5 years, but in every geography we have seen this pattern of periods of surge followed by a relative lull. Smaller regions within the country also have their own waves of surges and declines. There has been a lot of speculation about the third wave, and there are rumors that it may be stronger than the second, but this is not something that can be predicted. Normally, viruses can decline in their strength when they progressively have several waves affecting a particular population. But we really don't know about COVID because that was not the case in our second wave. We don't know about gene mutations either and whether they can alter all our predictions and calculations. So the COVID-19 pandemic has actually thrown up more twists and turns than even a thriller or a rapid moving movie. Overcoming the second tide of COVID-19 and keeping the vigil on the next wave is really the need of the hour. And this is a very, very important topic. And to discuss this, we have with us Dr. M.S. Kanwar, respiratory medicine specialist with over 45 years of experience in handling critical care and acute and chronic respiratory diseases. Doctor is a pioneer in sleep medicine in India and started Asia's largest and state-of-the-art sleep lab at the Indraprastha Apollo Hospitals, New Delhi. And his team has done the largest number of sleep studies in the country, and his research papers on sleep apnea have been presented in many world conferences on sleep medicine. Dr. Kanwar is currently leading the lung transplant program at the Indraprastha Apollo Hospitals, New Delhi. He has completed his MBBS and MD from the Government Medical College, Amritsar, and DNB Respiratory Medicine from the National Academy of Medical Sciences, New Delhi. He has also received pulmonary, critical care, and sleep medicine training from the renowned Mayo Clinic at Rochester in the US, and has also received an echocardiography training at the University of Alabama and training in lung transplantation at the University Network Hospital, Toronto in Canada. Practicing critical care medicine when he was abroad for 13 years, Dr. Kanwar is a consultant, has been a consultant in large teaching hospitals and an assistant professor of medicine many years abroad, and has now got also 33 years of teaching experience pertaining to respiratory, critical care, and sleep medicine, and presented various important research-related papers related to both bronchoscopy and sleep disorders. Welcome, Dr. Kanwar, to this COVID care series presented by Apollo Hospitals. We have been presenting various aspects of COVID-19 over the past weeks, and I'm really delighted that you're here with us to guide us on overcoming the second tide of COVID-19 and how do we keep vigil and make sure that the third wave is not upon us soon. Over to you.
Thank you. Thank you so much for your kind words. Well, we have seen what has happened to the world in the last 18 months or so, and since March 2020, when India was hit, and how the first wave, spread all over the country, but in patches. it was not a uniform pattern. And it surprised people because it was not that the communication between different states had been stopped entirely, but still it chose to be rampant in some areas, especially the metropolis, and relatively kinder to the villages. Subsequently, we also saw the decline, and then there was a little rise, then decline in Delhi. If we look at, we actually had almost 4 waves since the beginning. But same thing, you remember in Maharashtra, in Mumbai, there was a large wave followed by lull, and then, in the month of March, again, the second wave came. So these waves, as you've already just described, are basically the strength and the virulence and the transmissibility of the virus, which is at display, and also the helplessness of the world community, even the very advanced healthcare facilities around the world, looking so shamelessly helpless in the wake of an onslaught by the virus. So the first wave passed, and we thought we are done with it. And we thought we had a tremendous, pandemic, which we had never seen before. And we always compare that with the pandemic of 1990, 1918 to 1920, which was called the Spanish flu. And the similarities were stark and very visible. So that is what we compared, and we thought that things are getting better towards the month of November. November was okay. There was a little rise in Delhi, for example, but not elsewhere in the country. Then it settled again. And by December, January, February, I thought they were the leanest period when there was people moving around freely. Malls were open. The life was back to normal. But and those were the times when I was writing the textbook on COVID, along with 79 other authors. And that happens to be the world's first textbook, which is supposed to be launched in a couple of days by the chairman. And we were busy writing the book and seeing the patients and going into the COVID units, PPEs and back, and then started to write again till 3 a.m., those kind of things, phases of our lives we went through. But then came a wave, for example, in UK, and USA was still struggling with waves all the time. While we had our own problems, Spain had its own problem, Italy had its own problem, UK had its own, Germany and France had their own. And while the Far East was relatively quiet, and Australia was the quietest, and South Africa started getting a variant, and Brazil started getting a variant, and UK started getting B117 variant, and another wave started. And during the Christmas time, the UK was completely locked down. I was there in the UK at that time, and it was never like the Christmas. Anyway, it was all kind of shut. So that is when that wave started to decline, another wave started in India. So that, when we talk of the waves, we also have to look at the continuous mutation. This coronavirus is undergoing mutation after mutation. In fact, when we say double variant of B1617 or B1617.2, that played havoc in our country and killed, we don't know the unofficial figure, but killed. There is no family which has not been touched in the country. So we saw that this variant was more transmissible, more virulent. We didn't see the kind of deaths, the kind of ICU pressure, and the kind of pressure on ventilation. And you all know about the oxygen. The oxygen in the country was getting depleted, and it was not reaching the hospitals in time. And the patients dying without oxygen was unthinkable in the past, but it happened, and it was all over the media and the world knows about. What I'm saying is this variant, which was a byproduct, probably most likely rather, of B117 of UK. They when they do the sequencing and surveillance, they find that B117 is the parent. I mean, we are not talking about the Wuhan, the first wave. We're not talking about the further generations of mutations. So B117 was probably the parent of B1617, which became a double mutant in India. And there were a couple of other mutants also. For example, E482Q. Another one was L452R, which were again being feared for being more transmissible and lethal. But it was later on, very soon, in fact, within weeks, was dominated by this B1617.2 variant. Which
I'm so sorry, doctor. Can you talk a little more louder? I think you could be a little more audible. Please.
Oh my God. In fact, I'm speaking pretty loud. In fact, usually I speak
Now
loud.
Now
I
it's
don't know
better.
why this mic is not picking it up.
No,
Anyway,
now-
okay, I'll like try to be even louder.
It's
So
fine.
these variants, even in this B double mutant B1617.2, it is a misnomer to call it double mutant. It is actually, it has been found that there were 17 to 18 mutations inside that. And probably by now, when we are talking, it has probably grown much more. And while we are talking, there are more mutations which have already happened. So the virus is always a step or two ahead of us. We'll always be chasing. If the virus has gone down like that, if the curve has gone up and has gone down, please do not think it is all due to the lockdowns. Lockdowns have helped. But if you believe that it's all due to lockdowns, and if there were no lockdowns, the world would have perished, that wouldn't have happened. It is the virus which dies its own death. While it is becoming more virulent, more transmissible through its mutations to remain viable and survive, it also enters into mutations which are weak, non-transmissible. And when that thing becomes dominant and starts to infect people, it doesn't cause a disease. And it is probably, that is when the transmission chain gets broken. So if you look at all the places, even in USA, at one time, during Trump times, he never offered the protection in the form of lockdowns. The states did some partial lockdowns, half-hearted lockdowns at some places, but there was never a lockdown in the entire country. Yet, you look at those cities, New York, for example, California, Seattle, Florida, the waves went up and they came down like that. It is the virus which dies. So if you think that by giving drugs or by other means, vaccination, we'll talk about that. That is a separate issue. So if by doing that, we are going to kill the virus or stopping the virus in its tracks, it's not going to happen. But if we do lockdowns at the right time, when a disease is trying to go up like that, zoom up, that is the time to put the lockdown, rather than doing it at any other time, which is not useful. The idea of that doing lockdown is to decrease the possibility of overwhelming pressure on the hospitals and the healthcare facilities and the equipments and the oxygen and everything and the hospital beds. So if you think that vaccination is the answer is yes. You should all get vaccinated. It is important. Don't think that this vaccination may be only 60% or 66% or 70% effective. I may still have 30-40% chance of getting infected. Well, we do not know whether it is just the IgG antibody which we are looking at, which we can easily measure. We don't know what is happening to the T lymphocytic response in the body after the vaccination. But when they do the vaccination trials, I believe they look at the T lymphocytic response also in experimental situation, and then they come out with the conclusions that the vaccination, for example, Pfizer or Moderna is 93 or 95% effective, and other vaccinations may be a little less effective. but then those are smaller trials. You know, when you look at phase 3 trials for all vaccinations, the average time period required to create a vaccination is 10 years or more. And often it takes up to 17 years to make a vaccine. So the phase 3 trials last a couple of years. Here, the entire thing has been crowded within 3 months, phase 3 trials, 3 months, 4 months, and the trial is over. So you haven't followed those cases up. You haven't given that environment which would have prevailed, which would have actually given a very different picture. You haven't studied the effect in comorbidities. You haven't studied the effect in children. So looking at all these factors, this number digitally given to you is basically to get the emergency use authorization from the governments to launch the vaccines. Otherwise, they wouldn't get approval. That is the reason that you're having these numbers, and you get swayed by these numbers. Okay, should I get this vaccination or that vaccination? Oh my God, get any vaccination that you get. It is effective rather than not having a vaccination. This is message number one. And coming to second wave and then going on to third wave. Now we are into a getting towards a lull period. Yeah, we are not there yet, but the numbers are decreasing. In Delhi, in Maharashtra, the numbers have gone down a lot. The Delhi, the numbers have gone down from 29,000 a day to something like 1,000 something odd a day, or 1,500 a day, something like that. So, but in southern states like Kerala and in Andhra, in Tamil Nadu, still the numbers are on the decline, but it's still significant. So, but probably it's a matter of a few weeks. It is believed. I personally feel that in July you would have come down to almost the level which we saw, let's say in February or so early in the year. Now, if thereafter you find that after a lull in July or August or September, there is again a rise in the number of cases. You know, your genomic surveillance has to be superb. Unfortunately, India is lacking in that. The best genomic surveillance is being done and sequencing is being done in UK. But whatever we have to keep following it very closely. Not only the number of cases, not only new cases which might be cropping up, one might be missed, but also looking at the behavior of the virus. Is it changing shape? Is it a new mutant which might be coming up? Because the worry for next wave would not be what we have already had, would be what is in store in future. What kind of mutation we are going to face? Nobody knows. No scientist can predict that. So we'll have to keep our fingers crossed, learn the basics of social vaccine, which we have been trying to practice, but not everybody is practicing that. But probably this wave gave a big jolt because people lost their family members. People lost their near and dear ones. So they probably this time, which they didn't learn last time, would probably be more aware not to be making a joke of that social vaccine that we talk about. And also, the governments would not be so careless this time, like they were last year, dismantling those infrastructures that they had created and for accommodating thousands of additional patients outside the hospitals. They made them spend money, beds, ventilators also, air conditioning, everything, and they dismantle that. I'm sure they're not going to do it this time. That's why we hope that the third wave, if it comes, would be much better tackled. Thank you.
Thank you, Doctor. So, is the third wave really inevitable? Do you think that there is some way in which the virus might behave and we actually may not have a third wave at all?
Look, there are two things here. One is that the virus is constantly trying to mutate, constantly mutating. So when the virus is mutating constantly, then there is always a risk that a more virulent or more transmissible virus will crop up. Not all over the world, maybe, in some pockets in the world, in some places in the world. May not be in the entire country, could be in some places, in some cities, some districts. And from there, if you do not have a good containment measure in place, good surveillance in place, then you're likely to have it spread all over the rest of the places, rest of the state and the country. This is one aspect. The other aspect is that after the first wave, there were not too much of immunity established. But now, if you do the zero surveillance after the second wave, it would be showing a much higher immunity generated as compared to what we saw in the first wave. So probably I feel by July or so, you would have, I can't lay a figure to that, but maybe half the country or 40% of the country may already be having, this antibodies against the virus. When I say 40%, 50%, I'm talking about the cities. I'm still not talking about the villages of India, because the villages of India were spared in the first wave. They are partially affected in the second wave, still not rampant in the second wave. So that is the area where the virus can still attack. And so virus probably be able to attack those people who do not have any innate immunity against this. Then there is another group, the younger group, which has been relatively been spared relatively. But then when you do the zero surveys, it has been found that even children show a lot of IgG positivity. So actually, there is not that much reason to worry about children as it has been laid out. Oh, third wave is going to be massive. It's going to be a holocaust. It's going to affect the children. I don't believe that, because children have been exposed, and they may not be falling sick, but they have been exposed. But how much of immunity they actually have generated, it's difficult to say. The other thing is that the ACE receptors in children are less. That is why they probably are inherently also relatively protected against this virus. So these are the issues which will dictate what will happen. And the third thing, which is very important, how rapidly, how effectively, how massively you are successful in the drive with the vaccination. The more you vaccinate, the more you are giving yourself a chance to subdue the third wave.
We also hear of the term herd immunity. Are we likely to achieve any sort of, could you also explain the term, doctor? And also
that herd immunity is when the immunity developed over the period by repeated exposure or a single exposure to the virus leads to antibodies, so that you have complete or relative protection against the same virus. But that herd immunity, two things here. The herd immunity has to be 70 to 80% in the population to actually protect the population, that it is no more a pandemic. There may be areas of epidemic where the herd immunity is less, but then 70 to 80% of herd immunity, we are still not there. We are still not there. So until that thing happens, and we don't want that thing to happen through massive infections the way it happened now, if we can give vaccination and create the herd immunity, through vaccination, we will achieve the same thing. So what is very important is how rapidly the country is vaccinated. This vaccination drive so far is in, fits and starts. It's not the massive drive. We may be talking about this number. In India, we have achieved this part. Oh, India is a huge country. You have a huge population. You cannot compare with Britain or with Spain or Italy, that we have in absolute numbers, we have given more vaccination. We shouldn't take pride in that. What percentage of the population in the country? If it is only 6 to 7 to 8% population, then vaccinated, then where are you?
There's also a lot of vaccine hesitancy among people on one hand too, which we see in several states. For example, in Tamil Nadu, things are improving, but there was a lot of vaccine hesitancy. What is your advice to people on this, and the importance of getting vaccinated and not getting worried about all kinds of side effects that one always is reading about?
I think we have passed that bridge. We have crossed that bridge. because there was a lot of hesitancy about a month or 6 weeks ago, 2 months ago.
Yeah, I think we have.
It is better. It is much better. People are learning and people are seeing the experiences of others. And so it is not that bad. So as I said earlier in the talk, that whatever vaccine you get Covaxin, you get Covishield, or you get Sputnik, or you may be getting other vaccines now. Zydus may be launching soon. You may even be getting imports of Pfizer and Moderna if Biden is not is a little liberal. So all these things, whatever you lay your hands on, please get it and have yourself vaccinated.
And you do say that the vaccines are the key then to prevent the third wave from becoming catastrophic.
Yes, yes. And of course, your mental readiness of the governments, your ability probably to take prompt action would be much enhanced after the slap the central and the state governments all over got on their faces with the second wave. It was unexpected. It was not predicted. We as medical professionals also did not think it would go that bad. And the researchers, the scientists did not expect it to be that bad. But now, since they have seen what it can do, now some of them are even projecting a Holocaust scenario for the third wave, which I don't think is fair.
We were talking about the variants of the virus. Is it likely that the third wave will be driven by some new variant, or we don't know? Or
I told you, yeah, it would be new variant. It would not be existing variant. The existing variant would be dying. That's why the curve has gone down like that. But during those phases, new mutations are happening all the time, and some of them would go in a tangent, which would be a very, probably not only more transmissible, more virulent also. You see, our worry is that we don't land up in a situation where we are dealing with a variant which has evasion for investigations, evasion for drugs, and evasion for vaccination. If we land into a situation with a virus like that, and we are not prepared also fully, then we had it. So we have to be exceedingly, alert at all fronts. The researchers, the surveillances, the genomic surveillances, and India has to ramp up its genomic surveillance system. It is nowhere as close
about that, doctor. Like, could you explain to us what exactly is genomic surveillance?
So
I know that the UK has done a lot of it. And
they look at the virus, the structure of the virus, and the changes that are taking place. Now, the changes could be taking place in the spike protein, which is quite common, that the spike protein changes shape, or it could be in the DNA itself. So unless you keep checking the samples, random samples, but not random sample 1 in 10,000 or 1 in 1,000, you have to do much more sampling, which is not happening. So you're likely to miss a lot of activity happening in the shape of the virus. So you only, as a clinician or as a somebody who is doing the testing, you would only know this is positive, this is negative. That's all. But all the positives cannot be sent to the surveillance labs. They have a limited capacity to undergo the test, to conduct the studies. So, but they should augment their capability to be doing more testing so that more samples from all across the country be sent to them. And if they find that this is an abnormal, then they try to sort of look at the sequence, how it is behaving. And also they do the surveillance of the local area, those other positives which came from that area. And if they find that a lot of them have similar changes in the structure, then they club them together and they try to give them a name. And then that is how the containments are also done.
Apart from these waves, now what we saw this time also is now the resurgence of a lot of opportunistic fungal infections in those who have been hospitalized or recovering from COVID-19. Now, there is a lot of sensationalism on this because we get a new color of each fungus every day, black, white, yellow. But what do you have to say about it? And are they, I think they're all well-known opportunistic infections. Is there something that the public should know about these? And is it something that they need to be additionally very frightened about, apart from COVID-19?
There has been a little bit of enigma about mucormycosis. We'll come to that. But the public should not be too much swayed by what they see in the media and start to worry about small little things. If somebody has a sneeze, they start to think about mucormycosis. It's absolutely stupid. A usual rhinitis, a little runny nose, they start asking questions whether this could be. Somebody is having a headache. I mean, they're thinking whether this could be a mucus because I suffered from COVID recently. You see, this has been blown up out of proportion too much, but then at the same time, we have seen quite a few cases of mucor, and that is the enigma. Why they cropped up in such large numbers in the second wave when this thing did not happen in the first wave? We were dealing with the same COVID disease, only the virus has changed the shape, but the basic structure is the same. So what has happened? So, we keep thinking and we have our own discussions on that, whether it is something to do with the immunity. Well, the immunity went low last time also. But is this virus, this variant behaving differently, that it is causing such a rapid fall in immunity, which was not the case last time? Or is it something to do with the much heavier doses of steroids that we had to give this year, this time around as compared to last time? And because we had to save the patients. Saving the patient is the first priority at the time when the patient is dying of hypoxia and not responding to anything. And full flow oxygen, ventilator, BiPAPs, and non-invasive ventilation, HFNCs, they all not bringing the oxygen up to even 90%. So whether that is the reason, or whether a very high flow oxygen through the prongs and the masks and different masks. But then, it is, mucor is not known to prosper in liquid medium. So the same water, people use home oxygen therapy for years in chronic lung disease, ILD cases, for example, and they live for years and years together without any infections happening here. So that is also not a very plausible explanation. So diabetics, yes, their immunity levels are lower, but then we have seen patients who did not have diabetes, who did not even go on oxygen, who just had COVID. And so whether it is something to do with a vascular blockage, two things that happen in this disease is inflammation and coagulation. Whether microvascular coagulation is the reason, but then if that is the explanation, then why here? Why not everywhere? Though we have seen cases in intestine also, we have seen cases elsewhere, but they are rare. Mainly it is in the periorbital area, in the sinus area, and then going into the brain. That is the usual storyline. So this has to do something with the local thing. One of my explanations used to be, and probably it still holds good, that the virus, this is the area of entry of the virus. The nose and the mouth is the, and possibly eyes in some cases, is the area where the virus not only enters the body, but it also stays there for quite some time, because when you do the swab test, even after 10 days, 12 days, 14 days, it is still there. That's how you pick it. That's how your RT-PCR is positive. So it is there. It, of course, has penetrated, gone into the lungs, gone elsewhere in the body, gone into the effects are into the circulation also in liver, kidney, brain, heart, everywhere. But this is the area of the entry. Does it cause some kind of mucosal damages in this area, which then get augmented by, in certain cases, maybe by high flow oxygens, which patients are getting, or when they are not even getting oxygen, whether this area itself is more prone to, along with decreased immunity in this mutant, which has led to a more predilection for developing mucor, and mucor can start there. These are the possible explanations. But then the public in general should not be awed by the kind of information being thrown up. If there is one case, it becomes a breaking news for the media to run the channels. So we must see the whole thing in its perspective.
Doctor, we will now take a few questions which are coming on the FB Live real time. So I will read them out. There are a couple of them. The first one is, good afternoon, sir. My mother is a pneumonia patient for over 10 years, and she was under steroid of 2 milligrams daily and HCQ. Can she take the vaccine? And if yes, which vaccine is best for her?
Anyone, she can take vaccine. Number one, she should take vaccine, and anyone, Covaxin, Covishield, and the Sputnik, anyone that India offers at the moment, yes.
40 days over after my first symptom of COVID, but I still have tiredness. Can you please suggest some remedy?
This is called long COVID. Long COVID. I've written a chapter. One of the chapters that I've written 14 chapters in the book, and one of the chapters is on long COVID, where the patients, they tend to have weakness, tiredness, and fatigue, sometimes going into months. There have been reports, people reported on WhatsApp groups and others, and reported, and the case reports, and not only case reports, series reports from different parts in the world in different magazines, where they have talked about weakness lasting even more than 6 months. And in SARS-CoV, several years ago, they found that weakness in some cases persisted as long as 18 months. But most of the cases would come out of the weakness in about a couple of weeks' time. But some of them linger on with weakness for a month, 6 weeks, even 2 months, a few, even 3 months, 4 months, like that. But it goes away. I've seen cases with weakness lasting 6 months. I've seen quite a few cases. But then if I've seen, say, 15,000 patients, I might have seen about 15 or 20 cases where the weakness might have lasted about 6 months.
I must ask you this, doctor, because you're also a sleep specialist. Are there also sleep disturbances when somebody gets COVID? And is it because of the virus, or is it because of the fear and other?
It's the fear. It's this virus, especially in those patients who develop moderately severe or severe disease, they actually stare the death in their face. The feeling, the sensation that you can't breathe and you're going on oxygen, and you see other people on oxygen, and you in your own area, in your own ward, on your ICU, you see people dying. You know that somebody has died in the same room or adjoining room. That leaves a lasting impression. People start thinking weird things, rightly so, because they are not talking about that, they're thinking about their future of the children. So the psyche changes. So there are lots of patients like that who have sleep disturbances, but it's just a matter of a few weeks, and they settle down once the reality sets in. While you're back home, you're fine now, and you're no more in trouble.
Absolutely. Children are still out of vaccine. How will they survive?
That is the worry about the third wave. The third wave, one of the worries is that the children under 18 years of age, in fact, right now, even from 18 to 45-year age group have not been vaccinated, mostly, of course. But that's why the trials have already started, and initial results in USA with Pfizer is that the vaccines are safe to fight it's done by Moderna or the Pfizer vaccine, that it is safe for children, and they have started already vaccinating the children. Same is the initial thought process with the biotech, which have launched Covaxin, and they have also started their own trials. So this biotech's trials in children have already started, and hopefully they will come up with some results soon. But the children need to be vaccinated too, and especially before the third wave, if it is to come. So let's say 6 months down the line, then we should have ideally vaccinated the children also. We don't want to be in a situation where the children are falling sick, because a child falls sick needs a mother or a parent to help the child. It's not that you can isolate the child. You cannot isolate the child, especially younger children. So that means you're going to have that parent also get infected. And if the virus is very troublesome, very virulent, then you're actually talking about two lives at the same time. Children should be vaccinated sooner than later.
How much is the lifespan of the antibodies which are developed within us, and which is stronger, the one which you get by natural disease or by the vaccine? Please explain.
Well, the vaccine guys say that we generate better antibodies, but at the same time, they also have been shown to come down rapidly after 3 to 4 months. And in natural immunity also, through the disease, it's been found that it probably lasts 6 to 8 months. Now, it varies so much between different individuals that it is just it's not fair to even talk about a particular number of months, because in some cases the antibodies, we don't know the T cell, but we know the antibodies, they petered away. They never became positive even after the infection, even after being COVID positive and having symptoms. They never became positive. And some of them who became positive were very low. The IgG level was 6, 8, 10, like that, which is low, but positive, yes. So obviously, such people are likely to go down in their IgG levels pretty soon, maybe in 2 or 3 months' time. But there are people where the IgG level is in thousands, in 500, 400, 800. Even if it comes down, it will come down slowly. It will peter off over maybe a year or 10 months. So it's a huge variability, which would be difficult to assess. But yes, if one is very keen to know that, then you have to do serial IgG antibodies probably every 2 weeks to see what the trend is and how much time it lasts. And between the vaccine and the natural, it's difficult to believe that the vaccine would give you a longer immunity than the disease itself, which the vaccine manufacturers claim. But I have not found any plausible explanation why or it can be so.
Is it necessary to check the CRP levels of every 2 days in mild and moderate COVID patients to determine the line of treatment?
No. But somehow patients have come to hear about that, and they are just getting the CRP levels on their own and telling us my CRP on this date was this date was this. I said, well, who's advising you all that? Why are you doing it on your own? Anyway, it's not necessary. You have to look at the patient in its totality, clinical picture, and correlate with the labs. Labs only help. The main thing is the clinical picture.
My parents had taken the first dose of Covishield and then they got COVID before they could take the second dose. When can they take the second dose of Covishield?
3 months after the disease, they become negative.
I recovered from COVID 30 days ago and I had steroid for 5 days with a high dose of 80 milligrams BD, but I don't have diabetes. I'm very scared of getting black fungus. Could you please tell me, but my MRI reports are normal.
Sorry?
He or she says his MRI reports are normal, but I'm not sure what MRI, but the fear of black fungus having had a high dose of steroid.
MRI or what area? No. MRI wouldn't be. Anyway, The HRCT cannot be normal if it is 30 days entire picture, and the patient required 80 milligram twice daily of solid methyl prednisolone.
Yeah.
Then the CT scan cannot be normal if it is talking about the CT, not MRI, because CT changes would take at least 6 to 8 weeks to just leave behind some scarring, a little bit of fibrotic bands, but it will not look absolutely normal for a couple of months. So, I mean, you don't have to fear about black fungus like that, because first of all, it is uncommon in the context of how many cases in the country have suffered and how many of them have black fungus. You can actually average out how much is your probability. So don't worry about that. And now that your doses have in any case come down, you probably would be safer. And finally, steroids, it is nowhere clearly proven that it is steroids which have been responsible. It is one of the hypotheses.
So I think that brings us to the end of the questions also. So I must thank you, Doctor, for taking time off. I know you must be very busy during the time of this COVID-19 pandemic. You've taken time off very kindly, and I think this has definitely cleared misconceptions and created much needed awareness so that we can be very, very alert regarding the third wave, and also try to get vaccinated as soon as we can. Thank you so much, Dr. Kanwar. And with this, viewers, we have come to the end of our COVID care series. We have tried over the last month to cover all the aspects of COVID-19 care, and I really hope that you have found it useful to you. And we thank you for participating and making this series a resounding success, because it was your interactions that made it really lively and interesting. And I enjoyed too interacting with you every day. You can find all the links to our COVID care series on the Apollo Hospital's YouTube channel. So please subscribe to the YouTube channel and you can get the latest information on all the trending healthcare topics related to COVID-19. If you still have queries, you're always free to reach out to us through the Facebook page, on comments, or on the inbox or Facebook Messenger. So please, till we meet again someday, take care, be safe, stay healthy, and don't forget SMS at all times, SMS being social distancing, wearing the mask, sanitizing as often as possible, and do try to take your vaccine. Take care. Namaste.
Thank you.